Hi everyone, and thank you for joining me today. My name is Ariel. I'm one of the Fresno State Dietetic interns. Today we're going to be going over Module 9 titled Food is Medicine, Anti-Inflammatory Foods. So to start off, we're just going to go over some of our learning objectives for today. Number 1, be able to identify the causes of inflammation in the body and what signs and symptoms can result from inflammation. Number 2, identify risk factors for inflammation in regards to diet and lifestyle. And number 3, list 3 foods that can help prevent or reduce inflammation and 3 foods that can cause inflammation. So to start off, what exactly is inflammation? This is a natural process of your immune system that helps it to fight off foreign invaders, such as bacteria, viruses, or even plant pollen. It's generally short-term and beneficial, helping to prevent you from getting sick. However, chronic inflammation that persists without the presence of a foreign body can be harmful. It's been shown to play a role in the development of chronic diseases such as Alzheimer's disease, cancer, asthma, heart disease, type 2 diabetes, and rheumatoid arthritis, to name a few. But how do you know if you're suffering from inflammation? Acute inflammation tends to manifest as swelling, bruising, or redness to an injured area of the body. You may also experience a fever or flushed skin. These symptoms will usually go away within a few days and are generally not cause for concern. But chronic inflammation is often invisible to the eye and it manifests much differently. With chronic inflammation, you may experience joint pain, chest pain, constant fatigue, skin rashes or psoriasis, abdominal pain or fever. Mood disorders such as depression and anxiety can also be caused by this chronic inflammation, as well as unexpected weight gain. These symptoms will usually persist for long periods of time, such as weeks or months. So going deeper into the causes of inflammation, there are 4 main reasons that you may have developed chronic inflammation. These can be due to a cut or a scrape that allowed bacteria to enter the body or breathing in plant pollen, exposure to toxins such as pollution, something that is common in the Central Valley, or exposure to industrial chemicals. Autoimmune disorders can also result in inflammation such as lupus, HIV, or rheumatoid arthritis. Some lifestyle factors that can lead to this chronic inflammation are excessive drinking, smoking, and stress. These are all strong factors leading to inflammation. Exercising too much without allowing your body to rest, or falling on the other end of the spectrum with little to no exercise can also play a role. And finally, obesity and the lifestyle factors that influence weight gain can also lead to chronic inflammation. So now you know what causes inflammation, but what do you do to fix it? There are specific foods that have been shown to have anti-inflammatory properties. So foods that are high in antioxidants and flavonoids such as berries, leafy greens, pomegranates, citrus fruits, tomatoes, coffee and green tea can all help to reduce inflammation. Foods with high quality oils such as olive oil, nuts, and fatty fish are also beneficial, and chia seeds and flax seeds contain high amounts of omega-3 fatty acids as well. Finally, increasing your consumption of ginger, garlic, and turmeric. You just want to make sure that you add cracked black pepper as well to enhance that absorption. These have all been shown to be very effective at reducing chronic inflammation. These foods are commonly found in the Mediterranean diet, which is recommended for many different disease conditions, and it's found to be highly effective for those with heart disease as well. Following a Mediterranean diet cookbook can be an easy way to increase your intake of these anti-inflammatory foods. Vitamins, you may want to consider supplementing with advice from your doctor, maybe vitamins A, C, and D, as well as zinc. These will all help to boost your immune system and fight off the inflammation. While increasing your consumption of these foods, also pay attention to certain foods that you may want to reduce. Any fried foods such as hot dogs, red meats such as steak, cured meats like bacon or hot dogs, and refined carbohydrates should be limited as much as possible. Trans fats, which is found in some margarines as well as store-bought cakes, pies, and cookies, should also be limited as much as possible. Now, while diet is an incredibly important aspect of beating inflammation, lifestyle plays a big role as well. So maintaining a healthy body weight and exercising 3 to 5 times a week is really important. You want to quit smoking and limit your alcohol intake to 1 drink per day for women and 2 drinks a day for men. Make sure you're getting enough sleep each night as well and reduce your stress as much as possible. Walking, journaling, or meditating can all be helpful ways to get your daily stress under control. Inflammation is a natural process that occurs in each of us, but being able to recognize when inflammation overstays its welcome is an important tool in our arsenal for leading a healthier lifestyle. As always, talk with your doctor or registered dietitian prior to making any serious changes to your lifestyle and about any concerns you may have. Thank you so much for listening, and I hope you learned a little bit about inflammation today. Thank you.